Right.
I told me.
Hi, my name is Alyssa, and I am a first-year marketing major at Quinnipiac University. To start us off today, I'm going to ask you some introductory questions. So first off, what is your job position?
My name's Ashlyn, and I'm a physician assistant.
How did you come to determine what field to pursue?
So I always knew I liked science. I was always interested in medicine. I liked science. I knew I wanted to help people. So, going into college, I was thinking more, becoming a doctor and going the doctor route, MD, medical school. But once I was in college, I realized I didn't exactly want to do 4 years of school. Not that I didn't want to do it, but I just felt like it was a long time because you do the 4 years of undergrad, you have 4 years of med school, then like 3 years of residency, and then if you want to specialize even more, you have to do additional years. So I was doing research, and then I found a position, the physician assistant role and job, and you still got your undergraduate degree, but then you would go on and do like a between 24 months to 36 months of a master's program and get your physician assistant, your master's in physician assistant studies. So that just seemed more appealing to me. And I still was able to do everything that I wanted to do in a job.
Okay, awesome. And where did you study?
I did my undergraduate at Salve Regina University in Newport, Rhode Island. I studied biology there. I majored in biology and then minored in chemistry. And then I went on to Johnson Wales University in their physician assistant program for it was 24 months, but 2 years straight through.
Awesome. And how long have you been working in this field?
So I specifically work in dermatology. So I'm a dermatology physician assistant. I've been in the field for about like 6 years. As a physician assistant, it's been a little bit less than that. But I've used what I've learned over the years in my every day-to-day of my job.
Awesome. So if you were to go back in time, would you choose this career again?
100% yes.
Awesome.
I love my career. I love my specialty.
Okay, so what were your other interests when you were thinking about a career in the past, and why did you not choose them?
Well, I kind of already, I guess, touched on the medical school portion. I also was thinking about too, I'm a woman. I want to have a family someday, and I know plenty of women do it in med school, but I just didn't want to be delayed with my life too much.
Okay.
The other job I was thinking about was nurse practitioner, which in a lot of ways, physician assistants and nurse practitioners are very similar. However, to become a nurse practitioner, you need to have your bachelor's of nursing and be an RN. However, when I went to school, I started in biology thinking I wanted to do med school. And for me to switch, it was really difficult. I would have to kind of restart my 4 years again. And then after I graduated with my degree, I could have done an accelerated nursing program, but that would have been more time and more money essentially. So that's what made me kind of go the PA route more. And I also liked PAs learn more the medical school like module, while nursing is more the nursing school module.
Okay. So what were your biggest challenges you faced?
My biggest challenges, first was getting into PA school because it's about like a 13% acceptance rate. So that was terrifying in every way. Trying to apply and get in, but I did get into some schools, so I was very fortunate. School itself is a huge challenge and mental stress and a lot of work, but probably during school, trying to manage work-life balance, and really having not doubting myself and being like, no, I can do this. Like, I know this is hard, but I can do this. And in the end, I did. But that's probably the most challenging so far.
Okay, so what traits do you think you have gained from overcoming those challenges you just said?
Traits, Probably more confident because I'm like, oh, okay, like I got through this. Definitely more educated. I know a lot more obviously than I ever knew before, which helps me my every day at work. Um, and then, I mean, it got me to where I am today. I wouldn't have this job if I didn't do that. So,
Awesome. So, what is your greatest career strength?
my greatest career strength, um, probably motivation. I would consider myself a very motivated individual, and you can have all the smarts and everything. I mean, I wasn't the brightest person in school. I mean, I was smart, obviously. I got into school, but I wasn't like the brightest in my class. But I had a lot of motivation and drive, and that's what got me my into school. That's what got me my job, which dermatology is a very difficult field to get into, and that's how I got into it. Was because I had motivation.
Okay.
Called a lot of places and did a lot of background work years ago.
Okay. So similarly, what is your greatest career weakness?
Weakness, probably I stress out too much. Um, yeah, definitely. I think I've learned recently how to better manage my stress, but definitely stress is probably my biggest weakness.
Okay. That's a big one, yeah. So what advice would you give past you?
I would probably tell myself not to stress out as much
Yeah.
as I did. Because, in the end, I got where I wanted to be. My dream was always to, work in dermatology, which is why I wanted to go into medicine in the first place. And I do. I work in dermatology for years now. And, I was so stressed about that. And, everything fell into place. Everything worked out. So
I know you talk about how you chose dermatology and everything, but if when you were in PA school, were there any other fields that you were thinking about besides dermatology?
So I did like, I'm trying to think, what else did I like? I mean, dermatology was my top one, but I liked surgery, my surgery rotation. That was cool, which I do get to do surgery at my job now, which is nice.
Okay.
Um, I thought about internal medicine and like family medicine, a little bit more generalized, because you have to take an exam to get your license, and you have to retake that exam every 10 years. So it's probably better to be in something that you kind of see a little bit of everything in. Um, but I can also study too. So I kind of went more that route. I also really liked OBGYN too. I liked my rotation, but I always kind of had a special spot for derm. As I said previously, I worked in dermatology before. I worked as a medical assistant. I did a lot of rotations in PA school and derm. And that just really caught my interest. I like that I do medical dermatology, I do surgery, I get to touch on cosmetics too. So there's a lot of different options I can do in that field.
Right. So how do you make decisions at work?
So my job, I have to be making decisions all day long based, for patients, they come in, what to do next for them, how to treat their conditions, you know, um, how I base my decisions are kind of my past experience and my knowledge. I'll go off what I've seen before in patients, what I've learned before. Um, Sometimes I do have to do a little research on things. I also go off other coworkers too to help me make my decisions.
Okay. So when you make these decisions, do you ever doubt yourself?
Yeah, there have been times I definitely doubt myself. Um, I hope I'm doing the right thing. A lot of times things are trial and error. Um, I'm like, oh, I hope I made the right decision giving this patient this medication. Hope will this treat their condition? And like did I refer them to the right person? And did I do the surgery right?
Okay. So how do you gain confidence when you have doubt in your decisions? How do you go about telling yourself that you made the right one and ensuring that feeling?
So sorry, what was the question again?
Oh, good. How do you gain the confidence in your decision when you're doubting yourself?
So I always say, if I'm doubting something and afterwards, if I think, oh, this isn't right, I can always change it. I can always call the patient. I can change the plan. I can have them come back and again follow up pretty quickly if I'm, doubting myself. Sometimes I'll have them come back in a week, see how they're doing. A lot of times too, experience I feel like comes with that. The longer I've worked, the more I feel comfortable about things, and the more I see something, I feel more comfortable about it. And the more I treat a certain condition, I say, oh, this medication works best for this, or this treatment is best and this surgery method is best. So that's how I kind of regain my confidence, which I definitely have done over the years.
Okay. So how do you manage your time, and do you consider yourself successful at managing your time?
Mm, how do I manage my time? I try to do things in pieces. If I'm so at work, things can get really overwhelmed. I have a full schedule of patients. I see up to 30 patients a day. Um, and then I'll have all those notes to do. I mean, I have scribes, so that helps. Then, there's other tasks I have to do and patient questions and lab results and biopsy results that come in. So it's a lot and it's overwhelming. But, I try, obviously, I see the patients when they're there, but in between, I try to do, my other tasks. And I try to do, if I'm getting too stressed out with one thing, I'll stop it and go into something else and touch back on it later.
Okay. So what has been what has been more valuable in your career, your education or your experience? What do you think?
Oh, that's a tough question. Um, More valuable. I would say probably it's tough. So my education probably is the most valuable at this moment where I'm at. I'm a newer provider. Without my education, I can't work this job. You need to have your master's in physician assistant studies, and I wouldn't be able to work this if I didn't have that. But I do see a lot of people, I have a lot of coworkers and other, fellow providers that have years of experience. And I just see how, easy things come to them and how confident they are. And definitely, after years of being in the field, definitely your experience is much more important. And with PAs, we don't do residencies like med students do. We don't have residencies. We don't have fellowships. We're kind of trained on the job. So, in 5 years, my answer would probably be different. My answer would probably be my experience is more important because, a lot of we get in school. I was fortunate. I got, a longer period of dermatology training because I had more electives in it. But a lot of people get, if they don't do a rotation in derm, a lot of people get like 1 week of training in PA school for derm. So I was fortunate to get more, but definitely when I first started my job, I did a whole training. I trained with the doctor for like 7 months, and that was extremely valuable to me. I learned a lot from that.
Right. So that's interesting that you took your education, but then in the future you see your experience being it.
Yeah,
So
I mean, even right
as
now,
you
my
grow.
experience is without my education, I wouldn't be here and I wouldn't know everything. So it's definitely my like foundation. But I learned a lot. A lot of the stuff I learn now and things I see, I didn't learn in PA school. So I've learned that on the job.
Okay. So from what I've heard, you've accomplished a lot in your education. What skills do you have that you consider useful that got you through that higher education, especially the master's?
My motivation was one. Um, Other things that got me through my motivation, my persistence. So I guess it's the same thing. Um, I think not really a skill that got me through, but things that did were outside. My friends helped me get through it. Having that work life balance, that school life
Yeah.
balance is definitely essential. I think I wouldn't have made it really that far. Um, Definitely, I think being determined,
Okay.
probably all that. helped me get through, and everyone around me, my family and friends.
That's nice. So what has been your biggest success factor?
Like in my position or just
Yeah, in your field, like since you started working.
my biggest success factor? Probably, um, I did a lot of training with the doctor, but been working. I have pretty much a whole one of our practices all to myself. I'm the only provider there. And at times it's difficult because it's nice to have someone else, by your side to go off of. But I mean, I have plenty of coworkers and providers that are a phone call away or a text away.
Mhm.
Um, but I've been able to, since I've been at this location, our office has been a lot busier than before. I'm seeing a lot more patients than we're previously seen there. I'm doing more surgeries there. Um, yeah, I feel like that has probably been the biggest factor, like probably the best thing I've done so far in my job, really to prove myself. The patients are amazing at my office where I work too.
Awesome. Okay, so have you ever faced a career setback that you later realized was an advantage?
Um, yeah, actually, when I first was in PA school, we'd taken an anatomy class, which was cool. It was with cadavers. Um, and in the class, we had to do, we had tests. We had a written test and then a practical test, which was like stuff labeled on the cadaver. So we had to name. And I failed that first test, I passed the written one, not very, by the seat of my pants, but I failed the practical. And I was like one of like 5 people in the class that failed. So that made me really doubt myself and think, am I even doing the right thing? Like, this is the first exam and I failed it. Um, but that only made me want to do better. I stayed later in class. I stayed after class to work on the cadavers. I studied more. I didn't really have a life, unfortunately, for a couple of months, but um, I ended up we took 3 tests in that class, and the last one I had got the highest grade in the class. So,
Wow, way to come back.
yeah, it was.
Okay, so how do you handle disappointment in the workplace?
Um, Disappointment. So I don't let it get to me as much. Sometimes I do sometimes face disappointment with, um, I guess, patients, and if they're not improving with
Okay.
something. So I see a lot of different things. I see rashes. I see, different conditions. I see skin cancer. I see all different. I see acne. And when I have a patient that's coming in that's, not improving, I'm disappointed and upset because I want them to be better. That's my job, is to help them feel more confident or to get rid of skin cancer, not as much because we do get rid of those. We check and everything, but more, I think, the rashes, acne, rosacea. And if they're not improving, this is their face, this is their body. Like, it can be very detrimental to people, and in every right. And then I'm disappointed in myself for like, oh, I should have did this instead or tried that. And I make a tweak, and if it works, it does. But it's like I could have done that from the get go.
So how do you create motivation for yourself and for your team, like the other employers in your office?
Yeah. So with my team, so since right now I'm a sole provider at the location, I'm kind of like the head of the office,
Okay.
and I feel like it's my job to, you know, make a good environment, make everyone feel comfortable and motivated. And, you know, I I give I do have to, a lot of times, with my scribes and everything, if they're doing something wrong, I have to point it out and, tell them, try to explain right ways to do things. But when I see that someone's doing something good, I tell them, I let them know. I try to boost up their energy. I also am very friendly with everyone. I'm trying not to be that mean, scary kind of boss. Um, and make, everyone have, I try to keep a positive environment. And
That's
I think that has really helped to the fact that we usually have the same crew in our location. There's multiple locations, but sometimes we'll have other people come in and they all say how great our crew is and how much they like our office better than the other ones.
Awesome.
Yeah.
So how do you separate your personal feelings from difficult situations and or decisions?
My personal feelings, okay. I try to always keep work and my personal life separate.
Okay.
Um, Sometimes with things I feel like, it's difficult. My personal feelings about things, and then with work. So yeah, like for an example, I'll have someone come in that wants to be seen and they don't want to do anything that I am saying, and that makes me upset. And I try not, they decline any biopsies or treatments for things, and I want to get them better. I want to, if they have a skin cancer, I want to treat it. I want to help them out. And if they're declining everything I'm saying, that gets me frustrated because I want to help them. And I'm like, came here for help, but I try not to let that. I try to keep calm. I try to find other routes that we might be able to do something. Like for an example, I had a patient who had a biopsy proven superficial skin cancer, and they really didn't want surgery. And really, they were scheduled, but they never showed up. And that's what, I was inheriting them from someone else, another provider. And, I came up, there's a cream that can work. So the patient's like, yeah, I'll do the cream. I just refuse to have any, surgery or biopsy or anything. So, I kind of worked in that way with them, even though I let them know that, they might not have the same results. We'll have to follow up more closely, but.
So I know we've touched on this in previous questions, but to get more into it, dive right in. How do you successfully manage a work-life balance?
Oh, I'm just learning that. I think I'm still learning that.
Okay.
Now that, I have more of a schedule, it's Monday through Friday. I was in the beginning when I started working my job, I was staying really late hours. So I'd get there early, I'd stay late, I'd be working extremely overtime. And that was hard because I wasn't really having any time at the end of the day to do what I wanted to do. And then the weekends I was exhausted and didn't really want to do what I wanted. I just rested.
Yeah.
So I started telling myself, work is work. I don't take work home. If I don't finish something that day and it's past my time, I'll do it tomorrow. I'll make time for it tomorrow. And I feel like that's made me feel a little bit less stressed out and a little bit happier too. And it's allowed me to do things I want to do, like after work, like go to the gym, spend time with friends, family. I'm able to do that more now.
Okay. And do you see yourself as you continue in this career getting better at that?
Yes.
Okay.
Yeah. Because the more experience I get, the more I'll know and easier things will come to.
Okay. So what are 3 traits you have that you deem the most useful in this field?
Ooh, probably compassion. I would say I'm very compassionate with my patients, and I have a really, I feel like, and I've been told by others, I have a good bedside manner, and I think that's so important to have a good bedside manner, and be compassionate and empathetic with your patients because they don't want to be there and they're coming to you for help. They want to get better. They want their acne to improve. They want their skin cancer gone. They want their extremely bad eczema to get better. And I have the knowledge and the tools to help them. And, just understanding that. And, I've had patients cry in the room, and, it's hard, but you can't just be cold stone. You have to show emotion with them. Another trait probably would be, drive. So I want make sure I'm doing the best for my patients. So I'm constantly doing like extra learning and like continuing medical education. And I'm always reading, new, studies that have been put out because I want to know the most up-to-date procedures and medications, treatment plans, options for patients. to give them the best treatment that they can get.
Sorry about that.
Okay.
Was getting a call. Okay, I interrupted you. So go on.
No, I was pretty much done. So probably compassion, empathy, and drive.
Okay.
Yeah.
Awesome. So where do you see yourself in the future? Let's say like the next 10 years.
I still see myself in dermatology. Probably, I would like to, do more surgery. I would like to get more into cosmetics. I brush on it a little bit right now, but I'm planning on getting a Botox certification, filler certification, because that's another avenue too. A lot of my patients come in asking for that. And unfortunately, I don't do that specifically yet, but I can try to help them out in other ways cosmetically. But that's something I do want to do. I would like to go into education a little bit, furthering the education of PAs. So I want to be a preceptor for patients. I think that's extremely useful. Even do lectures at a school too. I would love to do.
Awesome. So I know there's people like Dr. Pimple Popper that take their career, that dermatology, to the next level and bring it to social media. Would you ever want to open up on social media platforms awareness of dermatology and the issues in the field?
I've thought about that. I think it's a good idea because I personally follow all those accounts and I think they're, helpful too because they are like medical professionals. I've thought about that. I wouldn't be opposed to it. I would just need someone to help me that, is good with that kind of social media, promoting myself, a little bit more creative because I'm not that way. So if I could find someone that can help me, I would.
Awesome. So who would you say that you look up to?
I look up to. Oh, honestly, my mom.
Yeah.
I look up to my mom. She is the best person I know. She's the one who's pushed me to get where I am. Um, she's always there for me, and I just hope to be like her someday as a mother.
And is there anyone famous you look up to?
Oh, famous. There's a lot of people. I've always liked Jennifer Lopez. I think, she's accomplished a lot and just doesn't stop. She's always going, the music industry, the dancing, acting, she's has makeup products, skincare products. She's really trying, she's a businesswoman in a sense. She is always after the next best thing.
Uh,
Another person like that, a famous, I see a lot of is Kim Kardashian too. She's very, she's not just a reality TV star now. She has multiple businesses that she's pursuing and that are very successful too. Definitely. And also Dr. Pimple Popper too. I do. Like every other dermatologist.
So what are some of the activities you enjoy to do to de-stress in your free time?
I like to work out. I don't really like it, but while I'm doing it and after I do it, I feel better. I got a Peloton last year and that really did help start to de-stress me. Not last year. I started using the app a while ago, but I got the actual bike last year and I find that kind of takes me away for a little bit. Also I'm getting my workout in, which releases and, endorphins and everything. Other things is spending time with my family and friends. They're the people who bring me the most happiness in life. So that's another thing I do too.
Awesome. So what do you enjoy most about your everyday job at work? What do you look forward to when you go in the morning?
Um, Honestly, my patients, they put me in a good mood. Most of the time they're, very nice. You get a few cranky one people here and there, but that's just natural. But they're the ones who make me want to go in every day. I love, talking with people and learning about people and trying to really help them in their problems, with, their skin problems, obviously, but I help out in other ways too. You see a lot more than you think in derm. I see a lot of psych too. I'm not a psychiatrist and I don't work in psychology, but I try to get them the right resources and try to talk to them too. But definitely, yeah, my patients, they always put me in a good mood.
Awesome. Okay, so this one's to end off, this is gonna be our last question.
Okay.
Imagine that you were invited to give a motivational commencement address. What would you name the title of your address?
Oh my gosh. What would I name the title of my address? Um, Probably one of my favorite quotes, which is by Audrey Hepburn, which is nothing is impossible. The word itself says I am possible. I'm possible.
Awesome. Okay, so thank you for your time.
No, thank you.
Hey,
I hope I answered all your questions.
you did. It was amazing.
Okay, good.
Have a good one.
You too.
Yeah.
Bye.
Bye.